Hi gal, so today we're filming from the American College of OBGYN meeting in DC, and I found the lady who wrote the book What to Expect When You're Expecting, which is a really popular and famous book for women who are having their first baby. I ran into the lady that wrote the book What to Expect When You're Expecting, which is a really good reference book for first-time moms or even second-time moms, or even if you've already had a baby before, maybe it's been a long time, you don't remember what it's like, or maybe you never had a reference and you were just doing things as you thought, best to do, but now you want to be more educated with your pregnancy. So the first part of the book basically focuses more on when you're planning your pregnancy. So what you should be eating, how to know if you're ovulating, when to try to get pregnant. So make sure you check out my video on how to get pregnant if you're trying to achieve a pregnancy. And it also talks about diet and exercise before and when you first get pregnant, and how your past medical history might affect your a pregnancy, either you planning a pregnancy and trying to get pregnant, or when you're already pregnant, how it can affect the pregnancy if it's not well controlled, like if you have uncontrolled diabetes. They also talk about pregnancy lifestyle. So a lot of patients ask me about dyeing their hair or exercising during pregnancy, and here, which is basically a very common question. So usually we say that you can dye your hair. It's not really a big deal because it doesn't really get absorbed into your bloodstream. And then we also say that if you're already on an exercise regimen, you can continue it, but make sure you see your doctor before you continue it, because you might have a high-risk pregnancy where it's not recommended to exercise. So most of the time it's okay, but make sure you talk to your own doctor and find out if it's okay for you to continue exercising. We do recommend not to, like, once your pregnancy is more advanced and your belly is large and your balance might be a little off, we don't want you doing anything where you might fall and hit your belly. So no like mountain climbing or riding a bike, stuff like that. You might hurt yourself. Okay, so then part 2, she goes and talks about each single month and what you should expect and what the OB visit's going to be like, and when you start feeling the baby move, and when you're going to have an ultrasound to find out what the gender is, if it's a boy or a girl. And also in this part, she'll talk about the delivery, and she goes into vaginal deliveries, and then she talks about C-sections and why you would need a C-section. So just so you guys know, most of the time our goal is always for moms to have a vaginal delivery. There are situations where you can't have vaginal delivery, like if the baby's sitting, or maybe if you've had surgeries in your uterus before. So in that case, you can talk to your doctor and find out if you're a candidate to try to have vaginal delivery after a C-section or after uterine surgery. But you can decide, or your doctor can let you know if you are a candidate to have a vaginal delivery after you've had a C-section. And then the next part is the postpartum period. So she'll talk about what to expect after you deliver, like how long you're gonna have bleeding, how long you should wait before you resume your exercise activities, or how long you should wait before you resume your sexual activity. And usually when you have a baby, we want to see you in the office if you had a vaginal delivery 6 weeks after you delivered, and we don't want you to have any sex during those 6 weeks. And then if you didn't start a birth control method in the hospital before you left, then at the 6-week appointment is when we would discuss that and start a birth control method. And if you had a C-section, usually we see you in the office 1 to 2 weeks after your C-section, so we can take a look at your incision and make sure it's not infected, you're not having any problems. And then again, we see you at the 6-week postpartum appointment. Again, if you haven't started a birth control method, you can start with then. And if you did start a birth control method, just to see how you're doing. Also, if you had like high blood pressure or any problems, we want to see you 1 to 2 weeks after you deliver, after you leave the hospital, so that we can make sure that those problems have been addressed. And then the next part of the book is she talks about like twin pregnancies or multi-gestation pregnancies, so more than one baby, either twins, triplets, etc. And then the next part is the father's part of the book. And then the next part is she talks about chronic medical conditions like diabetes, high blood pressure, and how those can affect your pregnancy. And then the last part of the book is she talks about complicated pregnancies, and here she also talks about how to deal or cope with pregnancy loss, or when you have a miscarriage, or when you lose a baby. So this is a really good book. It's a really good reference. I'll put the link. Also, her website is really good, so I'll put the link on the notes down here below. And make sure to like our video and subscribe to the channel, like us on Facebook, and now I have a Twitter account. So check me out on Twitter. I'm at Real GynoGal. So I'll see you guys next week.